Juvenile diabetes, that is type 1 diabetes, not what we think of typically as something that adults have to worry about, but not true.
Well, no, it isn't true. I mean, obviously the big millions of people, 20-some million people who have type 2 diabetes, a lot of it's linked to the obesity epidemic and lack of exercise and eating too much. Type 1 is very much a autoimmune disorder. It's where the body basically attacks your ability to make insulin, which you need to convert sugar into energy and go about your business. So it's very difficult. You have to have lifelong insulin injections, and yes, it affects both children and adults.
And it's on the rise globally.
Yes, 3% a year, which is, not insignificant, and it's both the prevalence and the incidence. So it's really starting to concern a lot of people in a lot of different countries.
So let's talk about screening. Tell us about this young man we're looking at right here.
Well, that is Percella Scarpinato, who is an adorable, now a little older than this, and now he's about 8. He was 3 in that time that he was being tested because his brother, his half-brother, was diagnosed with diabetes a few years earlier, and his mother decided, you know what, I don't want to, have the same thing that happened to his brother. His brother had really gone into kind of a diabetic shock and had to go into the emergency room, and she went and had the younger brother screened at a diabetes camp where they do some of these screenings, and sure enough, he had the antibodies, so they were able to track him, and sure enough, he did cross over into actually having an early, the early stages of type 1. They got it early, so there was no trauma. They were able to put him on treatment. He was able to adjust to the insulin and the shots and everything you have to do.
No life-threatening episode that sent him into the hospital that could have killed him.
Exactly.
And so let's talk about screening in general. Now, you mentioned this testing. Is it simply a blood test? How do they screen for this?
It's just a blood test, and what that blood test is going to show is whether you have antibodies that signal that something's happening in there where the immune system is beginning to attack your insulin-producing hormones. So it's, it's really a 5-minute test. You can get a kit that Diabetes Trial Net, which is the public-private partnership that's doing these screenings, they'll send you a kit, they'll send your doctor a kit, and then if you do have the antibodies, they'll say that you're at high risk and you should come back every 6 months. They'll give you an oral glucose tolerance test, and you're going to be asked if you want to be in some studies, which could help prevent or delay and the kind of looking for the cure. But the advantage is you're going to know earlier that you're developing this disease, and like the little boy, you're going to be able to do something about it. Now, you can't prevent it, but you can start preparing yourself.
And it is important to prepare. I mean, again, I mentioned life-threatening, episodes, but just so people know that they think like, oh, well, eventually if I feel bad, I'll go see the doctor. But the screening in advance is important. Why? What can happen to you if you get caught short with this?
Well, diabetic shock is, again, it's you can die. You can easily die, and if you wait till it's advanced or you get into a shock situation, your likelihood of complications are higher. And this is a complication that could affect your heart, your kidney, your liver, your organs, everything in your body could be adversely affected, and you could really have long-term problems.
Do we know quickly, Laura, why it's on the rise?
They don't know. There are genetic and environmental risks. This is all being studied. There are some suggestions that it could be linked to some things in the diet or viruses, maybe that kids are getting not exposed to germs because we're keeping them so clean.